So Dahid Dar, good afternoon everybody, and welcome to this extraordinary Trust Board meeting in public of the Royal Cornwall Hospitals NHS Trust Board. Just to explain, if there are members of the public who have joined us, that the matters we're considering today would normally be considered at a public board meeting. And therefore, although this is an extraordinary meeting held online, it is entirely appropriate that we hold our discussions in front of the public. So the meeting is being live streamed, and we will place a recording of the meeting on the Trust's YouTube channel. And could I just remind members of the public that Teams Live has the feature of live subtitles if you need them, and they can be accessed by clicking on the screen. Could I also just remind members of the public that we do really welcome questions, which we will take at item 6 of the agenda. And if you have any questions, could you use the Q&A function, the question and answer function on MS Teams, Microsoft Teams, and that these will be reviewed by the Company Secretary as per the protocol which is set out on the agenda. The Company Secretary will ask the question on your behalf, and then a response will be sought from the relevant director present, or in the unlikely event that a director can't respond, we will include a written response in the minutes of the meeting. The meeting in public will conclude, we think, at around 1:15. We've got apologies for absence from Richard Kramer, Non-Executive Director, and we've got apologies from those usually in attendance, from Kelvin Hipperson, our Chief Information Officer, and I think Liz Evans, his deputy, is deputising for him, which gives me the opportunity to congratulate Liz for being awarded an award for 25 years of service at the recent Silver Jubilee celebrations. And having said that, it would be remiss of me also not to congratulate Ian Dean, our Chief Finance Officer, who also received his award at the celebration earlier this week. So congratulations to both of you for more than 50 years service to the public between you. Then we also have apologies from Aled Jones, an Associate Non-Executive Director. Are there any declarations of interest relevant to this agenda, please, from members of the board? I can't see any. I don't think the Company Secretary can see any. So could we move on then to the first substantive item, which is Lord Mann's review of anti-Semitism and other racism, to which we're required to respond to NHS England by the end of this month. You have all the papers, so could I please turn to Alison Thorne-Henderson, our dual Chief People Officer, to introduce the report. Alison.
Thank you, Chair. I will take the paper as read and provide a little bit of commentary. The Lord Mann review concludes that racism, including anti-Semitism and Islamophobia, remains a significant issue within parts of the NHS, and that stronger action is required. The review calls for enhanced board accountability, mandatory anti-racism training, improved reporting and staff support, better use of workforce data and an approach of zero tolerance towards discrimination. For us as an NHS Trust, the key requirement is for us to demonstrate visible leadership, strengthen anti-racism action plans and improve staff's ability and confidence to speak up, and for us to monitor progress through our workforce and our staff experience indicators. In the pack today, there is a proposed statement on behalf of the Trust and also an action plan, and I'll take it. Any questions from there? Thank you, Chair.
Thank you very much, Alison. Are there any questions or comments on the Lord Mann review and the response to NHS England, please? Could we go to Adrian Davis, Non-Executive Director first, please, then to another Non-Executive Director, Adam Broom, and then to Ian Dean, Chief Finance Officer.
Thank you very much,
Adrian first.
Chair. Yeah, I fully support the paper and the statement. I would just like to know I would like some assurance that we have the resources in place to be able to deliver this plan. We've seen a deterioration in people metrics over the last year with cost improvement. We've seen a reduction in staffing. So I just would like some assurance that it's achievable.
Thank you, Adrian. Should we gather up the points and then go back to Alison rather than ping-ponging? Is that all right, Alison? So the first one is around resources. Then can we go to Adam?
Thank you. Adrian's asked one of my questions. My other comments really are on the actual statement itself, which is on page 9 in our pack, and just a couple of suggestions. The fourth paragraph makes reference to a group. I don't think the statement overall says what that group is in the actual statement, as I understand it. And then I suggest we add the board as well as the People and Culture Committee to the fifth paragraph, given how important this is. And I'll stop there. Thank you very much.
Thanks, Adam. I raised the question of the group. It's a non-sequitur as it's written, and I thought it was going to be changed. But Lindsay, you told me that there is a group, a wellness group it's going to report into. Could you just clarify for the board?
Yes, that's correct. There is an inclusive wellbeing group that has been established, and this is where it will be reporting. But we will absolutely certainly change the statement before we publish that, Chair. Thank you.
Okay, thank you, Lindsay.
Thank you.
So that one will be picked up. And then there's a point about the board. Is that for you or Alison, Lindsay?
Yes, Alison and I can work together to ensure that we update that statement. Thank you.
Okay, thank you. I think it's a similar statement to that being issued by our partner trust, isn't it? John Foster, next director. Sorry, I beg your pardon, Ian. Sorry, John, I've got Ian on the screen first and then John. Let's come to you first, Ian.
Thank you, Chair. So absolutely support the paper and the statements. Really important that we agree this as a board. One of my questions was on the action plan on page 8. It talks about strengthening confidence in speaking up and reporting routes. I guess, Alison, what I wanted just to test is how easy do we make it to raise concerns in the moment? And is there more that we need to consider as part of this action plan, and particularly that part of the action plan, about how we make that easy? So I'm conscious that, you know, on a night shift, it's how do we make sure that people are able to raise a concern when it happens? Because that's the best time to raise it whilst it's fresh in people's minds, and to flag an incident. So just to be assured that we've got an easy way for people to be able to report incidents when unfortunately they do happen.
Thanks, Ian. Shall we take one more from John so that Alison doesn't have too much of a pile-up of points, and then go back to Alison and then pick up the other points? John.
Thank you, Chair. Yeah, thank you for the paper, Alison, and as others have said, really wholly support the direction and the position that the trust and we as a board are hopefully taking on the matter. Two brief points from me. So one was a question and a little bit of challenge on the action plan on page 7. We've talked about trying to increase the quality and the amount of data we hold for colleagues around disability and ethnicity in that declaration. Wholly support that as an aim, and I just wondered whether or not we would want to expand that to other protected characteristics, as we know that also for particular ones will have a material impact on experience of colleagues at work, and is important for us to understand. So it feels like that could be a good opportunity to expand that. And then secondly, on the statement, just a brief suggestion on the very first sentence, which as it stands is excellent. So where we say we believe that everyone has the right to be their true selves at work, I wondered if we wanted to consider adding to that that people have the right to be their true selves at work, free from discrimination or abuse, which I think is the sort of the substantive point of the matter we're looking at in this report. So both to be yourself and express that, but to do so in a way that you're able to not receive abuse or discrimination following it. But yeah, those were 2 points from me. So thank you, Alison. A great paper.
Thank you, John. Should we go back to you now, Alison, so you don't have sort of endless points to deal with?
Yeah, thank you, Chair. The first point was about resources and do I believe this is achievable? I have plans to strengthen our approach to the EDI team, and that is coming to our Monday execs for consideration. So I'm confident that with the changes that we will have more capacity to support colleagues in the organisation in delivering this action plan. The second point was around the Inclusive Wellbeing Group, which I think Lindsay has answered. That's a new group that terms of reference have been signed off by ELT. In terms of speaking up, and I might look to Bernie to add to comments on speaking up. The point was made around confidence, and the second point was made around ease of speaking up. I know that Joe Burton and colleagues have extended. We've got a new deputy FTSE champion in the trust, and we have got extensive champions now. The bit about the system, I agree with your point, Ian, around it's best to make that capture the speaking up issue at the point that it happens. But I might look to Bernie if she would like to say, as the exec responsible for this, any other points on this particular point.
Okay, thanks, Alison. People who the people who raised the points, are they happy with Alison's responses?
I've got some
did you want to carry on, Alison, and then we'll go to Bernie, and then we'll come around the table.
Yes, okay, thank you. The statement is not the same as CFT, but mirrors, and really welcome the suggestions from John around including that free from discrimination and abuse. I think that's a really important point. We know that some colleagues experience microaggression as a form of discrimination and abuse, so would welcome that, thank you. And also John's suggestions around widening the opportunity to make sure that all our data is reflective of all the protected characteristics. Again, that is something that I would be happy to support and make the changes in the paper. Thank you.
Thanks very much, Alison. People happy so far who've spoken? Okay. So, Bernie, could we just go to you in case there's anything you want to follow up from Alison, from Ian's comments?
So, thanks, Alison, and thanks, Ian, for the points that you've raised. I looked at Ella. Freedom to speak up is the end point. We need to. This firmly needs to link with our culture work. As I looked to Ella and Alison, you're right. We've got a second guardian. But Joe's work is really now focused on working with the divisions and Ella's cultural work about how we empower people to raise things in the moment with their direct line managers or with their colleagues. I will reflect though, Ian, I think on your point around nighttime, and I think I'll take that away to think about what else can we do, because there are less people around in terms of the nighttime structure. About is there anything differently we may need to think about in terms of some of the cultural work around nighttime and how issues are raised. As I said, Joe and David are proactively working with the divisions and the culture piece around raising it in the moment.
Thank you, Bernie. So that brings us to Ella, who's next to speak. Ella?
Yeah, that is a nice segue into what I was going to say. So I just want to provide that assurance that the cultural transformation approach that we're developing absolutely has this at its core around the ED&I, the equality, diversity and inclusion elements. And I think it's really important to emphasise speaking up of course, really, really important so that we can, as a learning organisation, reflect on that. However, we're also focusing on ensuring all our colleagues have the skills to deal with, have conversations appropriately, deal with incidences that they see themselves. And it's not just those that are affected that need to speak up, it's the bystander effect as well, that I know we've all recently had training on. And we're focusing on cultural awareness as well, so that the onus isn't just on those affected and them speaking up, it's on all of us to ensure that we don't allow discrimination to take place in our workplace. I think I just wanted to make that clear, but our intent is to have this statement as very much a live document, that those the work of those people involved in the culture transformation will be living and breathing. Thank you.
Great, thanks, Ella. Kim.
Yeah, it's really, really important we socialise this with our 8 staff network chairs, and we have their involvement to some of that will be measuring whether our statements and the actions we're taking are effective. So I welcome that, Alison. And I think there is a link here as well, and how we join it up for staff. So for members of the public, there is a government strategy called Prevent that looks at radicalisation or potential radicalisation. So there is that. I think we need to be able to be cognizant of that as well for people who might want to raise early signs of behaviour before people find themselves in difficulty as well. So thank you.
Thanks, Kim. And now we go to Niamh Lamond, who, where titles aren't on the screen, just for members of the public, Niamh is an Associate Non-Executive Director at the Trust. Niamh.
Thank you, Chair. Just a couple of points from me. It's just in the statement in paragraph 2. I felt that in the first sentence, that unacceptable behaviour should not be tolerated and will be challenged. Should felt a bit weak to me. I would probably prefer to see must. Is there a concern about that, Alison? I mean, maybe you can comment on that. It just feels a little bit more committal. So that's just the first point I have. And the second point is in relation to discrimination, anti-Semitic or any racial discrimination among patients or against patients. I'm assuming that the Lord Mann report and the requirements of this are they cover patients as well. Am I right in that?
Alison?
Yes, absolutely. And to cover your first point, Niamh, as well, the should versus must is a very hotly debated conversation that we have when we go into this area, because it links very much to zero tolerance. So our aim is zero tolerance. However, we know there are occasions where we do not meet that requirement, and so that's why the language is written as it is. It's not saying that's what we want to do, but we know there are occasions when we fall short at the moment, but our aspiration is, and that's why the statement has been crafted the way it is, that actually what we want to do is achieve that total approach of anti-discrimination and anti-racism. But as I say, that
it just could be a little bit ambiguous. Yeah, it could be a bit ambiguous and staff are looking at it, well, I should, but I maybe don't need to, challenge it. So, it feels a little bit contradictory with the words that follow it. But, I'll take the lead from the rest of the board members on that. The second one is about the patients and how do we, get a sense that we've got levers around how we deal with staff, and we've got the staff survey and the culture piece that we're doing. How are we going to know about discrimination against patients or even among patients? Do we monitor that? Is there some mechanism for us understanding whether there's an issue or not?
Yes, we do measure all discrimination. We don't have one system, so we have to go to multiple systems in terms of discrimination that happens with patients or with staff, because the reporting mechanisms might go through FTSE, they might go through HR, they might go through DATEX. So there are multiple triangulation points, but we do bring it together and measure discrimination. And of course, ultimately, we get that reporting mechanism through the staff survey, where staff tell us, really importantly, how their experience has been from a patient perspective, working with patients, as well as working with other colleagues and managers. And we know last year, actually, we did a lot better as a trust in terms of our ethnic minority staff. We saw an increase in terms of doing better with less discrimination than we had previously.
Yeah, it just felt that the action plan doesn't say very much about patients, I didn't think. And I just seen, I think it's Ian's text in the chat. You know, how do we make it easy? Most patients, never mind, you know, patients are very likely to just say nothing. And you know, you really do need staff to step in, presumably, if there's visible discrimination among different members of staff, or sorry, patients. So I just felt it would be helpful to have something a bit more reassuring about the patient's position. That's all. Thank you, Chair.
Thanks.
Thank you.
Well, I think those are points, Niamh, perhaps that could be considered, because we've got till the end of July before we have to submit, could be considered offline. Are there any other comments that people want to raise before we move to a conclusion and the next item? So, with thanks for all the work that's gone into this, could I just move to the board decisions, perhaps just noting that those board decisions will need to reflect the issues that have been raised by board members today. So, for example, the statement will need to have some adjustments to it. And Niamh's points about patients perhaps need more consideration as well. But subject to that, could we note the publication of Lord Mann's review and the NHS England response? We need to approve our statement, clearly subject to amendments as discussed today, but noting that this aligns with Cornwall Partnership NHS Foundation Trust statement. So I would imagine that any changes that we want to make to our statement will need to check with CFT, so that we keep aligned in terms of the statement that's actually issued. And then we need to approve signing up by the end of July to the NHS Race and Health Observation 7 Anti-Racism Principles, and we need to confirm adoption of recognised definitions of anti-Semitism and anti-Muslim hostility. And we're also noting the International Holocaust Remembrance Alliance working definition of anti-Semitism. And could we also note that the Trust Action Plan will be monitored by the Royal Cornwall Hospitals Trust Inclusive Wellbeing Group. And of course then there's a line to People and Culture Committee and to the board if necessary. Is the board content with all those notings and approvals that I've read out, subject to the necessary changes to the statement? If so, thank you very much indeed. So that takes us on then to item 4, which is the post-death care board assurance statement arising from the Nottingham maternity review and from the Fuller inquiry. Could I turn to our Chief Medical Officer, Mary Kane, to introduce this, please? Mary?
Yeah, of course. So I will take the paper as read, and in the packs also a copy of the letter that we received from the NHS England's Chief Operating Officer and Chief Nurse, which hopefully everybody's had a chance to read. So the requirement for this board assurance statement, as Chair has said, is because of the findings of the Nottingham Maternity Review on the back of the previous Fuller Review. And some truly distressing findings that I won't rehash, but I'm sure you're all aware of. But the key emphasis is on the fact that we need to ensure that we bestow dignity, respect and security not only in life but after death, and that's our duty, and that's what we must make sure that as an organisation we are fulfilling. So in terms of the overall assurance position, we've completed the board assurance statement and we are able to indicate compliance or planned compliance by the submission date of the 31st of July across all 5 assurance domains. There is one outstanding action, which is that we need to have completed an organogram with an SOP detailing responsibilities for all the staff and teams involved in post-death care. I've already seen the draft of that. I have absolutely no concern that we won't have that document before the submission date, hence why we can agree compliance by that date. In terms of the Fuller inquiry actions, and I'd like to draw your attention to an error on page 15 of 33 of the pack. Of the, of the 29 recommendations, 21 are applicable to NHS hospital providers such as ourselves that don't undertake anatomical education using donors. And of those 21, we are fully compliant with 20, and we have a robust action plan in place to support the one recommendation at that point that we're not fully compliant with, and that is the need to have exit swipe ingress and egress from our mortuary facilities. There is action plan in place. It will be complete for the West Cornwall site by the 31st of July. It will not be complete on the RCHT site until slightly later. There is actually a possibility that it will be complete by the submission date of the PAM self-assessment around this date by the 29th of September. But I did want to recognise that that is an error in terms of saying full compliance, but I am able to say that we meet the criteria to give full compliance to the assurance statement. I hope that makes sense. Happy to take questions if I'm not clear. In terms of governance and oversight, we have oversight provided through the Human Tissue Act designated individual. We have divisional reporting. It's looked at by the External Visit Scrutiny Group and the Quality Assurance Committee. And we've had executive safeguarding oversight in line with the Safeguarding Accountability and Insurance Framework. There are 2 residual risks pertaining to the mortuary. One is the lack of full compliance, as I've just set out with the Fuller inquiry recommendations. That risk is currently scored as an 8, and we would hope that actually that risk will be able to be removed from the risk register once the estates works have been completed on the RCHT site. The other risk is mortuary capacity. Mortuary capacity is a challenge. It's currently scoring a 12. We have managed to mitigate it by a number of actions set out in the report, but it is something that at peak times can prove challenging, and therefore I think it's right that it remains on the risk register at this stage while we continue to work towards a more sustainable solution. So I am pleased to be able to ask for approval of the board assurance statement on mortuary care, with recognition of the fact that the necessary work on Statement 1 will be complete by the 31st of July.
Thank you, Mary. Could I just clarify in relation to those access and security issues you mentioned that won't be completed till the end of September, what the implications of that are in the way that we report this?
We're still compliant because we have a robust action plan that sits alongside. So the requirement is that we have either achieved compliance or that we have a robust action plan that we are tracking through appropriate governance structures. So the board assurance statement will remain compliant, and the risk hopefully will come down from the risk register as soon as that work has been completed. We are required also to submit the self-assessment around estates, but the submission date for that is the end of September. It is possible that we will actually be compliant at that point and be able to self-assess as wholly compliant, but we can't say that until we for sure know. We've now got the asbestos assessment, we're awaiting the full report, and then Natasha Quick is personally overseeing the piece of work, so that we should get pace behind it.
Thanks, Mary, that's very clear. Just wanted that to be on the record, as it were.
Absolutely.
So could we, sorry, there's some things popping up on my screen that I must now get rid of, or I can't see you. That's it. So could we go then to discussion? And first of all, Becky Hopkins, who is our clinical non-executive director. Becky.
Thank you, Chair, and thank you, Mary, for a very comprehensive report. Just wanted to check, are there any mitigations that can be put in place or are already in place prior to the swipe card access being resolved?
We've got good training, and it's exit not exit not entry. So we already have the security of entry swipes at RCHT. We've got really good training which we test. We do a degree of secret shopping to test that. So we are happy, and we obviously look very closely at any instance. We encourage reporting. So I'm happy that we are actually compliant in terms of making sure that we're monitoring appropriate recording of exit and ingress, but we simply don't have the swipe access yet.
Okay, thank you, Becky. Can we go to, perhaps we'll see how it goes, Mary, but maybe we'll take a few points rather than you coming back to everyone. But I don't want you to have such a long list that we lose track of it. So could I go to Ian Dean first, please, Ian?
Yeah, thanks for the paper, Mary. Just two quick clarifications, really. The first statement talks in the last bit of the sentence says, and regularly tested. I was just keen to understand what we mean by regularly tested in terms of frequency, and that we're content we're doing that. And then on the risks that you touched on the capacity risk, it talks about one of the mitigations is deployment of the 4 Nutwell temporary storage units. So have we got the same level of assurance to our business continuity plans that when we use those temporary storage facilities that we've got the same level of kind of control, I guess?
Thanks, Ian. You're happy to take a couple more, Mary, or do you want to respond now?
The regularly tested is we've interpreted that as the governance that we have around it in the governance reporting structures. So it's regularly tested via the mortality overview, MROG. I never get the acronym right. The Mortality Review Oversight Group. So we have that governance process in place. The roles and responsibilities are actually well understood, but what they weren't is documented, and we felt that to actually dot the I's, cross the T's and be entirely compliant, that needed to be in a document that was properly ratified. That's now already in draft form and will be taken through MROG, and so we will have that in black and white. But in terms of the roles and responsibilities, they're well tried and tested, and we are able to report through the ascribed governance. In terms of the Nutwell units, can I take that away? Because the answer is I don't want to give a response that is not accurate. I think the answer is yes, but I want to actually go away and check so I can bring that back.
Great, thank you, Mary. Can we go now to Ray Hall, Associate Non-Executive Director, please, Ray?
Hello, thank you, Mary. Just a quick question, because Ian's asked one of mine, which is, do we know how often we exceed capacity at the RCH mortuary? And if the West Cornwall Hospital is a decant option, bearing in mind that there is a risk around that at the moment, is how content are we with that?
I don't have the figures, but yes, we do know, and it does get reported on. West Cornwall work is complete or nigh on complete, so there isn't really a risk around that, if I'm honest. The challenge is that we get quite close to capacity on occasion in peak. See, it's the respiratory season, so it's the winter season. The mitigation really is that we need to ensure that when appropriate to do so, the deceased are in the right place, which is not necessarily in our mortuary, but might be with the undertaker. And that is a process issue that we're still trying to unpick with that particular undertaker that's mentioned within the paper. But I have no concerns around the use of the West Cornwall Hospital mortuary at all.
Okay, Ray. Adam?
Yeah, thank you, Mary. I'm just double checking, and apologies if I slightly misunderstood. I think the one outstanding risk is related to the Trelisk site and the exit swipe card readers.
Yes.
Annex 3 asks us to have a time-limited action plan to address any outstanding risks. You've said it should be done by September, but if it isn't, have we got a date in mind for what's our absolute cut-off date by which it will be done, the outstanding action at the Trelisk site to address the requirement in Annex 3?
We are hoping it will be done by the end of September. We are absolutely focused on doing so. So we are driving it forward as quickly as possible. The key blocker was the asbestos report, which is now undertaken, now done. We are then able to progress the work. So the action date that we have is compliance by the end of September, because I think that's realistic, and I don't want to push it out because it has been sitting on the action log for quite a while.
That's fine. Thank you.
I will track it.
Thank you.
Great, thanks, Mary. And Isabel Down, Vice Chair. Isabel?
Yeah, thank you. I was just really in support of Mary's response just now, because I think it's important to note that if there have been questions raised today, there's another opportunity for us to seek that assurance, because we have a policy committee next Tuesday, but also just to provide some assurance that we would continue to monitor this. This will stay on the quality agenda until we are completely assured that everything has been dealt with by whichever date is feasible. So we don't let go of it. It sits on our committee action log, and we continue to probe and seek that assurance until we're comfortable that we've covered all the outstanding points. So just to reassure people. Thank you.
That's great. Thank you very much, Isabel. If there are no other comments, could we move on to the board decisions on this? I'm just pausing for a moment in case there are any more comments. But if not, could I thank Mary and everyone who's worked so hard on this? And I really hope it is reassuring to the public after the Ockenden report on Nottingham maternity and the appalling actions of David Fuller, that the public, and particularly relatives and friends, are assured that we treat their loved ones with the care and the respect and the dignity that they would expect, both before they pass away and afterwards. So thank you very much for that assurance, Mary. We have to approve the board assurance statement on mortuary care, noting action will be and is being undertaken to ensure compliance ahead of submission to NHS England on the 31st of this month. And I think, Lindsay, it might also just be worth noting that we are issuing a compliance statement and that we do have an action plan to complete the other issues that Mary mentioned, which won't be completed until after the end of July. If that's acceptable to the board. Okay, thank you all very much. And thanks again, Mary. So could we just go on then to item 5, which is consideration of risk arising at this meeting, but also we combine that now with anything which we might wish to celebrate in terms, for example, of our determination to combat racism in all its forms. But Lindsay, you usually take us through this.
Yes, thank you, Chair, and really welcome, obviously, colleagues' comments. Also, I think we've articulated through the discussions today that we are monitoring the risks associated with our mortuary on our corporate risk register, and they will be monitored as matters are resolved. And obviously there is processes around assurance through our quality assurance committee. I think from that perspective, Chair, I don't think there's anything much else I was going to suggest that we incorporate here, but obviously welcome colleagues' comments.
Thanks, Lindsay. Any comments from board members? If not, I think that's fine. Thank you for that. And then we come to item 6, questions from the public. Do we have any, Lindsay?
Unfortunately not, Chair. We don't have any comments or questions from members of the public.
Okay, thank you very much. And then item 7 is the effectiveness evaluation of the meeting. Any board members have any comments on evaluation? What worked well, what could be improved, or any other comments? Adrian?
Yeah, I thought it was a good meeting, Chair, and the papers I thought were really clear in what they were looking for.
Thank you very much. And I can see Ian's thumb is up, so he's agreeing with that, as I'm sure we all do. Okay, so thank you very much for that as well. So we're now going to move into one item which we need to discuss in private because it might refer to commercial sensitivities or to third parties or to individuals, so it can't be considered in public. The next public board meeting will be on the 3rd of September. You have just for board members and people who attend board, you should have a separate invitation in your calendar to join the private board meeting, which will start at 1:15. So it just gives you a few minutes to stretch your legs and be back for the private board at 1:15, please. But with thanks to anyone who might have been observing our meeting and to the board for finding the time for this extraordinary public meeting, could I thank you all and close the public meeting and see you again in the private meeting. Thank you very much.
Thank you.